spread and containment and precautions taken. So first of all, I'll deal with the district demography and the whole population and the overall the district profile. Basically, Dahod is a tribal district. It has a population of 27 lakh. There are 9 blocks, 547 panchayats are there, and Dahod is basically having rural pocket influence. Dahod has interstate border with Rajasthan and Madhya Pradesh, and it has inter-district border covering 3 districts. So I'm here to discuss the strategy involved. First of all, I would like to tell here that preparation with mission and vision is the key to success. What we did in Dahod. So first, I'll discuss 2 strategies. First is preventing the spread by following the theme of prevention is better than cure. And secondly, dealing with coronavirus infection and spread. So first strategy I'll discuss is prevention. What we did, we formed the clusters, panchayat-wise clusters we formed in Dahod. 547 clusters we formed. And first step we did was adoption of Panch Mantra. In Panch Mantra, we took 5 things. First was Ayurvedic medicine, that is Kadha-Ukala, to boost the immunity. We served each village, each panchayat with this Ukala, and we made sure that 3 to 5 times each people residing in the panchayat had this medicine. That was Ayurvedic. Second was bulk sanitization, in which we used sodium hypochlorite solution, in which basically all big buildings, all habitations, etc. were sanitized. Third was individual sanitization, covering individual people, households, and masks, etc. were taken. Fourth one was fogging. Fogging was done to kill the mosquitoes, parasites, etc. larvals, so that other infections doesn't erupt. Last was public address system, in which we used mics and loudspeakers in each panchayat to create awareness for do's and don'ts, and to make sure that we take care for elderly people as the mantra given by Honorable Prime Minister. Now I would like to share here the video which was covered by national channel Aaj Tak for our work related to Panch Mantra. Thank you. Next was all the mantras were adopted simultaneously in one panchayat. That is 1 point with addition to all 4 points. And in this way, we created community awareness, and we took the help of Sarpanch, all the village level organization like self-help group ladies and health personnel people. Second point was our ruthless containment. We followed the principle of ruthless containment, that was complete sealing of interstate, inter-district, inter-block border. And every sealing point was made as a check post to monitor it efficiently. Third point was with the inter-district border sealing also, we created inter-panchayat border sealing. For that, we created a movement register at each panchayat level so as to keep the check on the ongoing movement within the panchayats. This made us to seal the panchayat border also with the adjoining panchayats. Fourth point was influx of migration and efflux was totally stopped. Shelter home was created in this regard so as to help the migrants. Fifth point was fifth point is very important point which really helped us to contain the corona infection, which was home to home surveillance, which was carried out by our whole health team for each household at least 3 times in toto, in which we mainly focused if we got any cases for ILI, that is influenza-like illness, and SARI infection, severe acute respiratory illness infections with high priority. And we also created a sort of atmosphere in which mass compulsion was made with disciplinary action and legal backing, which really helped us. Even Prime Minister stressed on mask. Then what we did was, in the initial March, we created a corona control room and a war room. it was made to have a strict IT-based surveillance, human-based surveillance, so as to monitor effectively. In this, we used all our officers of the district, all the personnel of the district and block panchayats, so as to cover each and every panchayat minutely and with whole dedication and devotion, so as to counter every case and every ILI and SARI case, migration case, etc. with vivid detail. Eighth point was immediate checking of migrants was also done. Like if any migrant is coming from any district, any state, even Madhya Pradesh and Rajasthan, many of the people were coming. We did immediate checking of migrants. We shifted them to quarantine centers, in home shelters, etc. And so as to make sure that the infection doesn't spread. Because our motto was to control the infection and never to make it spread. Ninth point was continue. Ninth point is very important point because it is a very long process, and as Honorable Prime Minister stressed that the corona warriors are almost equivalent to God. So what we did with continuous moral boosting of all the staff personnel involved, so as not to have any mental fatigue, physical fatigue, etc. And this moral boosting really helped us in every point, that is in home-to-home surveillance, in every other thing. And last point was we did a stringent focus on lockdown principles and social distancing as mentioned by the government, as mentioned by our district, and as the decision taken by us. Now I'll discuss here the second strategy, that is on corona infection containment. What we did, we also applied the principle to test maximum samples. We covered all the 9 blocks and we tried to test maximum sample where SARI cases are there, ILI cases are there, migrants are there, any foreign national coming from foreign nation is in touch also, etc. We took that also. And in this regard, till today, we have covered 663 samples. Out of these samples, total 4 cases were positive, which were exactly linked with the cases who had earlier corona or were in contact with the corona patients. In this 4 positive case, 2 are already cured right now. And after curing also, we have taken 3 to 4 sample testing. And right now we have 2 active cases and death is 0, which is very good for our district. Right now we have 0 death from corona. Active cases right now is 2, and these 2 people are almost very much stable, and we are pretty much sure that within 5 to 7 days they will be also cured. In this regard, what planning our district did was we made 2 corona hospitals specifically with all due arrangements, including isolation center. In these 2 corona hospitals, every arrangement, including ventilator, including corona room, etc., bedding, everything was made in very earlier than the predicted time. The predicted time was 24th, 15th March, 20th March, but we covered all this by 10th March. We were very much sure with our all arrangements. Next was we also made 10 COVID care centers. COVID care center was mainly made for if any patient is coming with high SARI infection or if the patient is little asymptomatic having corona. So we made 10 COVID care centers covering each block. We made sure that each block has those centers so that when the block is distantly located, it doesn't impact much. Then we had government quarantine centers, that is 9 government quarantine centers were made with all adequate facilities, and we made sure that we had around 22 such centers. If need arises, it could be extended. What we did was we made teams to monitor home quarantine stringently. Actually, what happens in many states and many districts, we saw people are in home quarantine, but they don't follow the rules and regulations which are to be followed. So what we did here with the police personnel and our health staff and our other panchayat staff, we made a team to monitor each home quarantine stringently so that they don't mix up with the general population. And what we did, any corona positive patient was found, then his or her family was made a total containment zone. And in that zone, we made sure that no one comes out, no one goes out. Everything was properly reached, that is ration, milk, etc. And we made sure that there is no mixing for the general population with that population. Also, we made that 8 shelter homes were running, which even could be extended, and all the migrants and in fact those people who are not having adequate job or food, etc., are staying here happily. We are making sure that even their recreation is also being taken care of. Now, this is a very minute step what we did. As soon as we sent the sample for the testing, we were almost very much sure that if it is negative, then also if it is positive, then also we have to take care of that. So first of all, contact tracing was done. We had around 50 to 70 contacts. with the person involved or the nearby families and etc. So after contact tracing, what we did, we quarantined the entire contacts, and we controlled that, and we shifted the patient to the hospital, mainly corona hospital, and then we treated the personnel, the corona patient, the positive patient, and we also treated the contacts with proper care. And then we regularly tested to check whether the patient has come positive and now it is negative, or what is the actual situation. So regular testing with the help of health personnel was being done, and we had adequate staff in the district to monitor, adequate doctors to monitor the corona infected patient. Now proper care and caution is also very much mandatory and needed for the health personnel. We provided each health personnel with every care and caution, that is PP kit or any other thing for the precautionary materials, because even their health is too important for us. And for the basic main important point is round the clock deployment of qualified personnel was there to monitor the whole situation. We never let the situation in the hands of anyone. It was totally qualified person who were monitoring, qualified doctors, qualified medical officers who were round the clock deployed. Now I'll discuss here the result or the success of our district. I will say here it's a very good thing that now our cases are only limited to 2, having a population of 27 lakh, and we have only 2 cases right now with the whole rural influence pocket. So basically, it's a very successful story for us. Cases now we have that also are doing very much normal. There's no much symptom. Second is we safeguarded the people from this outbreak because people had the perception that if one outbreak happened in panchayat level, it would lead to whole chaos and confusion and the whole spread of the corona infection. Third was this led to community strengthening. Every people from each community, from village to panchayat to each community, they were strengthened, and right now everyone is fully aware of every other thing, what to do for the containment of the corona spread. Fourth was awareness creation. Fifth, the basic Indian feature, unity in diversity, was also seen in Dahod. Sixth is this helped us to make building for the health infrastructure was really built, because what we observed were the lacking points for our health thing. We observed that, and dedication of corona hospital for the district also we did, because proper corona hospital was not there in the district. Now, what is our future is what we need to do in the future was more stringent monitoring would be required as the lockdown opens, because we have already made the plan that as the lockdown opens, how to proceed smoothly and gradually. It is not immediately types. So we have we need to be more stringent. We need to be more careful, very cautious, very careful. Second is the missing facilities and gaps which still exist also needs to be fulfilled. For this, we have written to the state, also to the central government also, for giving us the adequate things to fill the gaps. Third is always we need to be prepared for any happening. This was the future. This is the actually future for us, because no one knew about the corona infection spread. So we need to be prepared for any happening. And we have to make sure that there is no more cases of corona in Dahod, and we have to make Dahod as a green zone Dahod, so that there is no infection, everyone lives happily. Thank you so much.
That was very impressive, Rachit sir. And I would guess that our panel members will have some questions now. So
sure,
we'll move to that.
Mr. Madan Mohan, your question first.
Okay, thank you. First of all, congratulations, Mr. Raj, for such a nice presentation.
Thank you, sir.
And
thank you, sir.
In fact, if you ask me, it looks like as if you have followed an ideal procedure. I mean, without any gaps, because
yes,
you care both in terms of prevention and cure.
Yes.
But I hope, Gujarat is one of the states, more so Ahmedabad and other places which are highly infected. So I hope others should follow your this model, especially in Gujarat. So I don't know if you are doing anything to popularize such a model. There's one question I have. Secondly, how you were testing these corona cases? 633 only you have tested so far?
Yes, sir. 633 samples we have tested, in which we have taken the lab, because sir, what happens? We don't have lab at Dahod. We need to send the sample at Vadodara. So sir, every day around sir, those samples we are collecting and we are sending it to Vadodara. We are trying to cover each pocket, sir, so that no pockets are left if they are having ILI SARI infection, and the sir protocol SOP given by the central government how to go ahead with the testing.
Okay, because this is one of the major issues, testing, because you never know. Of course, your population, most of it is tribals and all that,
Yes, sir.
and I assume they are more near to the nature, and
Yes, sir,
as
yes.
such also there may be less, more resistance to such things. But anyhow,
Yes,
you have done a wonderful job. Now, one
Yes.
or two more questions I like to. Can I take two more
Yes,
questions
yes,
now?
you
Yes.
can, you can.
Okay. Now, how is the scene in neighboring districts? You have done good, but what about your neighboring districts? Any idea?
Yes, as a neighboring districts, we have
What is
Chota Udaipur, Mahisagar, Panchmahal, etc. Sir, Chota Udaipur is having right now 13 cases, 1313, and Mahisagar is having more than 5 cases, and Panchmahal is also having more than 7-8 cases. Sir, what the success for us helped us is we exactly the day before, even sir much earlier, we locked the whole zone, and we sir followed ruthless containment. Sir, even the people who were coming for burial of the dead bodies of their relative, etc., we strictly said no, because sir we didn't know exactly the what is the actual situation and all. So we confined the term to ruthless containment. We were emotionless in this.
Very good. That's okay. Now, another small question is with regard to, creating livelihood and all those type of things, and then
Yes.
how you are doing things to see that your people are.
Sir, sir, very rightly said, sir. As soon as the day Honorable Prime Minister said, "Jaan bhi, Jahan bhi," the same day we started with our teamwork. And sir, Dahod is mainly a district with Manrega works and even 14th Finance Commission works also. Sir, we have opened the works and we have made sure that there is no effect of social distancing and lockdown principle should not be violated. And right now, sir, as such today, sir, we have 12,200 laborers in Manrega in Dahod. Today, as on today, we have taken most of the water-related work, sir, because the summer season is coming and Dahod also experiences high summer also. So we have taken water-related works and we have made sure that each labor which is employed to cover water-related work should follow the stringent rules of lockdown and social distancing. And sir, in Manrega, we have taken all varieties of work so that rural employment is also enhanced and their livelihood is also enhanced, economy is also enhanced. In addition to that, sir, masks and additional things which has to be made. What we use, sir, self-help group ladies, we employed them, and every block has a self-help groups. So what we gave them order to manufacture the masks, to make the mask, and we procured from them on the minimal rate as prescribed by the government. And sir, what they did, they made the mask, they gave it to the whole panchayats, and they earned also. So in this way, sir, right now livelihood has come on a balanced form, on the equilibrium form, with the help of Manrega, self-help groups and other things. But as on part of industry, sir, industries may right now the government has not given that permission to open in the municipality zone. So right now we are facing the curtailment on that part. Rest all in the rural economy we have started, sir.
Good. Now, my last question to you is, see, perhaps you have somewhere missed it regarding Arogya Setu. No, I would like to know more about that. Do you think
Yes,
it should be made compulsory as they are advocating now, or
sir, for
perhaps you have to popularize that?
yes, sir. Sir, Arogya Setu was also taken by our team. And what we did right now in the whole district, we are having 50,000 apps. As on today, they are working. We have also popularized them with the public addressal system. We have also asked our each department staff to make sure the people connected with that department to employ it, to download it and use it, because it is really very fruitful. But sir, right now, one thing is very important in Dahod is like, sir, Arogya Setu app, sir, here the the economy is not that, they don't have smartphones and all. The phones they're having is a very minimal type of phone because major influence of rural pocket. So the persons residing are who are good enough, so they are doing it, and we have made sure that each and every panchayat who are good people, who are good well off to, they will do.
Yeah.
Yes.
Okay. Thank you very much.
Thank
I
you, sir.
appreciate your presentation and the efforts you have put in.
Thank you, sir. Thank you so much.
Mr. UK Sharma, sir, if you have any questions.
Yes. Congratulations, Mr. Rajit.
Thank you, sir.
Very meticulous planning and very meticulous efforts for containing the COVID in your districts. But I would like to know your own state, Gujarat, and you also share your neighborhood with Rajasthan and Madhya Pradesh. And you, within your own state in Gujarat, you have a number of cases. So 3 sites, you have full chances of carrying and catching the corona infection in case the curb is lifted. So please be careful about the influx of infection from various sites, which has huge potential.
Sure, sir. We'll definitely look into that.
Testing will have to be a work in progress.
Sure, sir. Sir, we have also started antibody testing also, which is giving actually true results. Because what we did, we tested the antibody sample with the corona positive patient also, and 2 bands were seen. So it was true. Then we tested majority of the people who came out negative. There only single band was seen. So that also we are doing to have a glimpse of the population survey.
Okay, thank you.
Thank you, sir.
I have 2 questions, Rachit ji.
Yes, sir.
My first question was regarding Arogya Setu that you have already answered. I'll only ask how many downloads are there in your district?
Sir, it is around 50,000 downloads have happened till today morning, sir. Okay. And we are trying to popularize it even more. And sir, we have also thought to make it a compulsory app so that people should be aware. Those who are having, sir, smartphones for them only. And those who doesn't have, then sir, right now we are not making it compulsory for them.
And my second question is about awareness.
Yes.
What are you doing for spreading awareness on lockdown and on COVID-19 and benefits of social distancing? Second, are people really aware and informed regarding the threat of COVID-19 virus? Are they taking necessary precautions, and are they adhering to the government advisories and directions in your district?
Yes, sir. Sir, regarding awareness, sir, we have already adopted the panchayat, in which the 5th component was public addressal system. Sir, in this, what happened was we used the public addressal system to state to every people in the panchayat with the loudspeaker mics and to make sure that they are totally aware of the existing thing. And sir, very happily I could say that though they are having rural pockets, but people at this level are so much aware that they are not allowing any people from outside even to come inside of the panchayat also. This is the level of awareness. And sir, the informed citizenry has also been seen, which people said that Dahod being a rural pocket, they don't have informed citizenry. But I would say no, sir, because people at every panchayat level right now, they are much aware for corona and they are really careful also and cautious also, sir. And it is just because of our team effort also, sir, because our health team went to the every panchayat level, they narrated, then the public addressal system was used, and sir, they are also cooperating with us. They are not, sir, they are not doing any violence against the police people or health. We have not reported any such case of any violence. So that is the best thing, sir. Even the elected, what sir we did, we chose to also share the stage with elected representatives. They helped us a lot. That is, sir, every panchayat has sarpanch, etc. All the punches and all, sir, we took them also in our war against the corona, and this really helped us a lot because, sir, by choosing elected representative, people started believing on them more. That is the status, sir.
Thank you.
Right. So it was a very informative and quite knowledgeable session. Thanks for sharing the model with us, Mr. Rachit Raj, sir. And we really hope that it is actually and actively replicated in other districts as well. Right.
Thank
So
you
with
so
that, I would end the session now. With that, I would end the session now, and thank you, and very nice it was having you with us. And thank you, the
so much.
panelists and
Same
Mr.
here.
Deepak sir for coming with us. Thank you.
Thank you,
Thank you.
sirs.
Thank you.
Thank you.
Thank you.